All right, we are meeting today with four moms of patients here. And if you guys don't mind, starting with Bella's mom, if you guys would just introduce yourself and talk a little bit about how old your daughter is and how long she's been sick and what she has.
My name is Keisha Stevens. Bella is my daughter. She is just turned 15 on Sunday. She was diagnosed with CRPS last year. She broke her heel 2 years ago, but was just diagnosed last year.
You're from Texas.
From Texas.
All right.
My name is Christine. My daughter's name is Samantha. She is 17 years old, and she was not officially diagnosed with CRPS until we got here in February, but she has been sick since she was 12 with some various things, but ultimately it was CRPS, we've come to realize.
My name is Tina. I have a daughter that's 22 years old, and she's had CRPS for about 3 years after she had her foot reconstructed.
My name is Tracy, and my daughter is 16. Her name is Jordan, and she has full body CRPS. She also has Ehlers-Danlos and POTS syndrome as well, and she's been sick for about 3 years. She tore a ligament in her ankle, and it all started at that time.
So you guys, you've all been down the medical route quite a bit.
Mm-hmm.
Yes. Tell me a little bit about the most frustrating part of that.
I actually, we have not really been, I had an orthopedic that actually, which is crazy because I haven't had as much horror stories as other people. Our orthopedic actually was the one that mentioned this, and he sent us to several doctors, and the doctor in Austin said, I don't think this is what she has. She doesn't have the classic signs, symptoms, and she didn't. But then talking to you guys, Anna was saying there's no classic signs. It's just what her symptoms are. And so I made this appointment in November in hopes that I could cancel it, but we couldn't. And so we came when school was out. And so I haven't had as bad of, I think, stories as some people have. So.
No, go ahead.
My daughter, it took us about 2 years for her to be diagnosed. We kept going back to her same surgeon, and he kept wanting to do a couple more surgeries, and we went ahead and did that. And then finally, I said, we need to go see someone else. And we went to a different orthopedic. He walked in the room. Of course, I had lots of pictures to show him. And right away he said, this is a classic sign of CRPS. And we said, we've never heard of that. What is that? He gave us brochures. Fortunately, we were lucky because he actually teaches at Northwestern University interns. So he was very familiar with CRPS. And then that led us on a journey of finding you. So I'm very thankful for that.
Yeah, and one of my biggest frustrations and Jordan's was, once we found out that she has CRPS, and it's just the doctors, there's just not enough doctors that know enough about it, and due to the fact that they don't know about it, they just chalk it up to being, it's in your head.
Yeah.
It's anxiety,
Yes.
it's stress.
Mm-hmm.
You actually heard that?
Definitely.
Yes, we heard that too.
Yeah, even from Jordan's gastro doctor, stomach doctor, the same thing. And that's just the most frustrating part for us, saying that it's all in your head, it's anxiety, and there's nothing we can do to help you.
And
so that
I wanted to say too, even a story with Dr. K yesterday, my daughter relayed that when she came here, she didn't even believe she was sick because she had been told, you are not sick. This is you're doing, this is in your head. And she didn't believe she was sick. And it took us getting her here and telling her, no, we know you're sick. We know there's an underlying
It's
cause
real.
for this.
It's real.
And there's just so many doctors, rheumatologists, neurologists. We have very good insurance, we've seen specialists that are top in their field who just don't have a clue really how serious this is and how detrimental it is, and just so much misinformation. So that's why my husband actually found you by reading the specialist we had been to and doing his program, his medical papers. He's a rheumatologist, and that's how we discovered what CRPS is, because they refused to call it that, even though that's what we were suspecting. So, yeah.
I just want to say one more thing. After the second doctor we went back to our original surgeon, and we told him, we went to this other doctor, and he said that she has CRPS. And he looked at my daughter and said, that's just something that doctors that don't know what they're doing give a label to. And then I was like, we never went back there. So
I think it's also too that our girls look, to everybody in the outside, they look normal. They look normal,
Yeah.
and they are.
Yes.
But they don't. It's a it's a disease that you can't see, and so like with my daughter, she says if they don't see it, they don't believe it, and so that's something that it does. They look healthy on the outside, and so it's just something that I haven't had, when she was diagnosed with it with a pain management doctor, she wanted to put her on all these different medicines, and I just wouldn't do it. Wouldn't go there yet, because I heard horror stories about that, and just the brain fog and the things that the side effects of that. So we just didn't do those things. And so somebody shared your video with actually another friend of ours that her daughter has it. And I was on your page all the time, just watching videos and updates and all of that. So that was just needed to be here.
And that's why we're doing this video today, guys, because so many times it's mom that finds us. And we're doing this for you, if you're watching this, to give you some hope, because I imagine it was not an easy road to come here. And I'm going to bring up some of the objections we hear, which is you have to co-stay in Arkansas for 12 weeks. It's expensive. I would say midline about probably $30,000 or so if I have to add it all together. What do you guys have to say to those objections?
there's no objections. It wasn't a choice. I needed my daughter to have some kind of life. She didn't have a life before. She would stay in bed. Stay in bed. And she would call me in pain. And I didn't have what do you tell your daughter when she calls you crying because she's in pain? So there's no, you do whatever you have to do.
You can't put a price tag on,
Right.
your children.
It doesn't
or
matter if it
anyone
costs
else for that matter.
$100,000. You sell your cars, you sell your house, you do whatever it takes because you want to give your daughter a life.
I read something from a mom, and she said, you take out a loan for a car, you take out a loan for a house, you're going to, I realize for some people, they don't have work. They can't work. I mean, we are moms and we are, helping, but like people that it's actually happening to, because you see everything here, but they're here and they're so grateful to be, because it's hope.
Yes.
It's hope. It's hope. And so,
yeah, and even driving back and forth, because we're from Chicago, and we came back down Sunday. It's 21 times we've driven back and forth, and but again, it's so worth it. After 3 years of not getting anywhere and Jordan just getting progressively worse, I wouldn't change it for anything in the world. No matter how much it costs, no matter how much travel is involved, it just doesn't matter. You do what you have to do for the sake
your
of
child.
your child,
Yeah.
and anyone else that is suffering with CRPS. It is so worth it. So I couldn't be happier to be here.
And being in Arkansas, the people are really, really friendly.
They are.
It's a very beautiful state.
It is.
It's gorgeous, and the people are unbelievably
The staff
kind
here.
well. Yeah, they go way beyond. But even talking about the community in general is very nice.
Bella loves it. I mean, she absolutely loves it here. She says all the time, she's like, I love it here, because she's like, people get me. I don't have to explain myself. I don't have to, they just understand. And she said, she just talks about all the staff and everybody. And so she loves it. She didn't want to go home.
That's
My
how
daughter
Jordan
does.
is too.
Yeah. So she. I mean, in it's Fayetteville's. It's beautiful.
It
It
yes.
is beautiful. I miss home, and I miss my people. But it is. It couldn't be a prettier place. And like I said, the fact that she's happy here and she loves it here makes all the difference in the world, because and it is. I mean, you think about I said this all along. 12 weeks. I knew it would be hard. I didn't realize how hard it. I mean, just in the simple fact of just being away from home and not having, because you are with. I mean, she sometimes probably wants to hurt me and vice versa. I mean, that's just,
We all go through that.
We're
It's
all together
all the same.
in a small space.
Yes.
But she loves it. She loves it. So I mean, and I feel the same way. So you do what you have to do.
And you see improvements in them. They might not see improvements in themselves, but as a parent, you see that.
Yeah.
And it happens at week 1, week 2, week 3, and every week you see changes in your child.
Yeah.
And they're all positive.
So what are some of the elements, you guys? I talk a lot about how this program I feel is incredible and it should be available nationwide. These pediatric pain management programs to me are
Torturous.
Yes.
and so if you guys can help me out, but I think the sense of community here is very important. We break those privacy barriers down.
Yeah.
Yes.
Yeah.
Yes.
Because these girls are used to, I don't want to say faking it, but they're used to.
They are.
Yeah.
They put
Putting
smile
on
their
a put a
face.
A brave
smile on.
face.
Yeah.
Yeah, my daughter went through 3. She just graduated from college, and for 3 of those years, she had to put on a brave face and go to class every day and pretend like nothing was wrong, because no one understood why isn't she getting better? You know what I mean? Like, so.
How are your daughters doing?
Sure. Bella's doing good. She, we're still, hers is in her right leg and foot, and her leg is pretty much the pain is gone from her leg. We still have some pain in the mornings with her ankle and foot area, but after neuromuscular, she's been consistently getting down to 0, and she goes to sleep at a 0. So she's doing very well. We want that morning to, I mean, of course, I'm her mom and I want it 0 all the time, as we all do. But she's doing well. And like I said, she loves it. I may not bring her home. I mean, she may not bring her home.
We do have a university.
She's got about 4 more years of high school.
Yeah, high school, yeah.
She's already said she's coming to school here.
Yeah.
I'm just saying.
Samantha is doing well. She is not at the pain levels yet that she would like to be, but knows that she will be, and is really encouraged. I mean, she is like a flower that has bloomed. It's just
Yeah.
it's so incredible to see her tackle each day like a person and enjoy it and be happy and dreaming of going to school in August and college, and just I could go on and on. It's just amazing.
She has a future.
She has a future.
Yeah.
Thank you. She has a
Yeah.
future.
And she's looking forward to her future.
Yes.
And we've seen her change.
Oh, it's amazing.
Yes.
She's a different kid.
She's a different kid. So anyway, yeah, she's very happy when it's time to go to school. She's going to be ready to go wherever she is, and I'm just so grateful.
Yes. I'm talking like she's my kid. My daughter's in her 8th week. She's doing amazing. A couple weeks ago, she got down to a 0, and I was shocked, as I think she was shocked. But she hasn't had 0 pain in 3 years. So, and I think that whole week she stayed at like a 0, maybe went up to a 2. You know what I mean? She's had a couple flares, but other than that, she writes every day. You have to write down what your pain level is, and she's consistently been like writing at a 3 and a 4, which to her, you can survive in life
Yeah.
at a 3 or 4.
Yeah.
So I'm very happy.
Yeah.
So.
Not that we're happy with that yet. But
Yes.
And like you said, it's a start. Jordan's doing very well. We're in our 11th week. And when we first arrived here, she was at a constant pain of 8. And we've gotten it down sometimes to like a 1 or 2. And, but she's kind of sustaining about a 5 right now, which is much better than an 8. So we're definitely going in the right direction. And there was nothing better than coming down here, and even after the first couple of weeks, for the first time in a long time, seeing a smile on my daughter's face. And seeing her being able to eat again, normally, and not have that nausea and all that other stuff going on. So we're just staying positive, hopeful, and keeping our faith, and it's going to work. Definitely is going to work, and it is. And so we're happy with the progress that she's made. Very happy.
Do you guys have any advice for a mom that's watching this now thinking, how could I possibly do this, figure this out?
Well, I can speak. I'm a single mom, and, I have no family. I'm in Chicago, and I'm pretty much doing everything on my own. And the way I look at it is, where there's a will, there's a way. As moms, we just figure it out. We do what we have to do, no matter what the circumstances. And it just takes a lot of strength and positivity, and just push through whatever it is that you're going through, and just keep going. There is no stopping us as moms.
I call it the crazy mom syndrome.
Yes.
Because I was crazy looking. There's something out there. There's literally something. I'm not giving up. I'm not putting her on pain meds. I'm not putting her on a spinal thing. Those were the choices. No, there's other choices. So you just keep fighting and don't ever give up. You know what I mean? And once you get here, the community here with these moms, is unbelievable. The support system in this waiting room is unbelievable.
We become family.
We do. We do.
Yes.
And we help each other. If someone's having a mom is having a bad day because they don't understand what's going on, we are supportive of each other, and we help each other through that. So
Yes.
You guys, thank you.
No,
for
thank
doing
you.
Thank
this.
you.
I love your girls.
They love you. They love you too.
Yes. So much, and we'll forever be grateful.
Yes.
For
You
what
gave us hope.
Yes, what you and your staff are doing. It's amazing.
Yeah.
And thank you.
I take my hat off for you, because I always say there's one thing worse than CRPS is watching your child
Yes.
suffer
Absolutely.
and being helpless. And you're brave and you're courageous. And I've seen you drag your daughter in here when she didn't want to be here. You said, I don't care.
That's me.
And so I take my hat off for you, because you're on the wall fighting for your child when everybody else gave up.
That's what I was gonna say. I think we have similar situation where I brought my daughter to, not willingly, and I say, make call. If nothing else, call and ask a few questions. Yeah. Get some information. See how you feel when you call, but just call. And, we made an appointment, and we were like, nope, we're not going to go. But we made an appointment. And we said, we're going to pray for a miracle. And if that miracle doesn't happen, then the miracle is in Arkansas.
Yes.
So,
That's right.
but that's what we did. So call. I just call and just talk to them, because they will change your mind.
Yes.
And I know after a while with Jordan, as the years go by, they start to lose hope, because nobody believes anything's wrong. So why would they want to go to another place? So it's just to, push them, drag them, whatever you have to do. And once you're here, you'll definitely see the difference.
Thank you so much for
Thank
doing
you.
this
Thank you.
video. Thank you.